Assalamu alaikum. We all know the name of intrinsic pathway and extrinsic pathway, but do you know the story behind its names? When scientists sucked blood from any one blood vessel and they took it into a test tube, they found that the blood forms clot. So they thought that the test tube has some pollution on it, but or the test tube has some dirt, so it forms clot. So they wanted to clean it properly, and they cleaned the test tube properly, but after cleaning it, the blood forms clot. So they thought that the blood has intrinsic some capability, or blood has some intrinsic capability or some intrinsic factor which causes the formation of clot, and this formation of clots they called it the intrinsic pathway, because the blood forms clot by itself or by its intrinsic factors. So they call it intrinsic pathway. And after some years they found that if we add sodium citrate, which inactivates calcium, then the blood doesn't clot. So after that they use sodium citrate so that the blood doesn't clot. But after one day they found that after putting anticoagulant or after putting sodium citrate, and if we give calcium along with tissue factor means any tissue serum or part from any tissue or fluid from any tissue, if we give that tissue factor, then the blood again forms clot. So they thought that these factors is given from extrinsic environment, so they name it extrinsic pathway, and thus the name of extrinsic and intrinsic pathway came. And let's see what is found in extrinsic and intrinsic pathway. In intrinsic pathway, the intrinsic factors are factor 12, 11, 9, 10, and which activates one another in a cascade phenomenon, and thus activates prothrombin, and prothrombin activates thrombin and fibrinogen. Thrombin activates fibrinogen, and fibrinogen ultimately causes fibrin fiber to be formed. And in extrinsic pathway, it starts with tissue factor, and tissue factor activates factor 7. When factor 7 is activated factor 7 in turn activates factor 10, and factor 10 along with factor 5 ultimately cause that reaction. And thus it is the intrinsic and extrinsic pathway. And you can see that the extrinsic pathway is small, so the extrinsic pathway is much faster than the intrinsic pathway.